These are members of the Deaf Women Association of Nigeria. They converge in Abuja, Nigeria's capital city, for the 13th Annual Deaf Women Summit. The summit began with a medical checkup and sensitization.
Is sexual and reproductive health all about sex? Is it all about having babies? Let's check. Let's see. Let's listen.
Executive Director, Maternal Adolescent Reproductive Child Health Care Initiative, Comrade Olubumi Lawal said, deaf women in Nigeria do not have adequate access and knowledge of sexual and reproductive health services and rights.
It's amazing to know that as women, as men, as young adults, we actually have right to some basic health intervention, which globally is being promoted to be an integrated services. And that is what we discuss. How much access do our deaf women have when it comes to sexual and reproductive services, when it comes to contraceptive services, when it comes to issue of illness, issue of pregnancy care, antenatal, family planning, delivery. How much access do they have to quality healthcare services? And it's actually worrisome to discover that most of our women here, almost 300 of them, who actually came from different states all over Nigeria, actually do not have access to good quality sexual and reproductive health. Now, take for instance the issue of antenatal. The government of Nigeria actually promised us free antenatal, but more than 90% of the states here do not even have access to good and quality antenatal care. They don't have access to free delivery. And it's also worrisome to know that the healthcare professional, most of them do not actually pay attention to the need of deaf women. They have been abandoned, they have been sidelined, and their healthcare services is not being responded to as should be. And another issue that we discuss is access to NHIS, National Health Insurance scheme, that is currently known as National Health Insurance Authority. I also believe strongly that sexual and reproductive care is the right of every citizen without leaving any woman behind. It does not matter if you don't have education. It does not matter if you have or you are living with any form of disability. The government actually owes us this much. And that
National President, Deaf Women Association of Nigeria, Helen Alasibayoku, said the 2022 summit is aimed at improving and educating deaf women about their reproductive health rights.
All this work is just to promote deaf access to public health, and as their rights for them to know. For deaf women, they face a lot of issues. For this year, this summit, we want to end the exclusion of deaf women access to health. Why this is important is that a lot of deaf women, they are in silent world, and they are treated without getting the right information. So there's need for them to be informed on the right ways to approach these things. They have access to justice. They should have access to justice, proper education. So not having interpreters. So that's why we have this national summits where we have deaf women themselves. They can address their pain. They can talk about their pain, their barriers, and we prefer solutions.
The summit is an annual event that is organized by the Deaf Women Association of Nigeria to seek solutions for issues concerning deaf women. Emmanuel Onu, News 24.